You wake up at 2 a.m. to use the bathroom and think, it's normal, I'm just getting older. But what if I told you that this seemingly harmless habit could actually be your body warning you that a silent tumor is gaining ground right now? The biggest problem with prostate cancer is that it doesn't usually scream with unbearable pain right away. Instead, it whispers through small changes in your daily routine that you're probably ignoring, or worse, blaming on aging. Today, I'm going to reveal the 5 warning signs most men only notice when things are already out of control, and one of them doesn't even seem related to your prostate. Before we get into it, make sure you're subscribed to the channel. That way, YouTube makes sure you don't miss our next health strategies and keeps delivering this kind of life-saving information to you. Now pay close attention, because the first sign is something you do every single day, but may have never truly stopped to notice. 1. The trap of interrupted sleep. That walk to the bathroom at 2 or 3 in the morning? Most men over 45 accept it as an unavoidable cost of aging. But here's what nobody tells you. Your sleep should not be interrupted like this. Imagine your bladder as a water balloon and your prostate as a ring wrapped around the balloon's neck. When the prostate grows or becomes rigid due to a tumor, it starts squeezing the channel, like stepping on a garden hose while trying to water your lawn. The result? You push, but your bladder never fully empties. There's always a little leftover inside. And shortly after you go back to bed, your brain gets an urgent message. Hey, there's still liquid here. So you wake up again. The danger isn't just feeling tired the next day. The real problem is that this constant retention can hide the growth of abnormal cells. If you've started waking up more often at night over the past few months, don't blame age. Your body is warning you that something is blocking the flow. But interrupted sleep is just the beginning. The next sign shows up while you're awake, and it says a lot about how hard your system is working. 2. Changes in your urine stream. If you're a man, you probably remember how it was in your 20s. Strong, steady, fast. Over time, you may notice the pressure dropping. It takes longer to start. The stream feels weak or hesitant, and it ends with that annoying dribble that stains your underwear. Most men ignore this because the body adapts. You get used to waiting a few seconds at the toilet. But here's the danger. This isn't just a plumbing inconvenience. When a tumor develops in the peripheral zone of the prostate, it may not squeeze the urinary channel right away. But as it grows inward or triggers inflammation, it creates physical resistance. It's like buildup inside your home's pipes. Water still flows, but without pressure. If your urine stream feels tired, or you have to strain your abdomen to finish, stop and pay attention. Your system is under overload. And if you think that's bad, wait until you understand why the next sign is often mistaken for simple back pain from a long workday. 3. A warning in your back and hips. This is probably the most frightening sign, and the one men ignore the most because it doesn't seem connected to the prostate at all. How many times have you felt a dull pain in your lower back, hips, or thighs and thought, I must have slept wrong, or it's just getting older? You take a painkiller, it improves a bit, and life goes on. But listen carefully. Prostate cancer has a dangerous attraction to bones. When cancer cells spread beyond the prostate, one of their favorite places to settle is the spine and pelvic bones. Think of them like silent termites eating away at your house's structure from the inside. Unlike muscle pain, which improves with rest, bone pain is deep, persistent, and often worse when you're lying down. If you have back pain that doesn't go away or constant hip stiffness that stretching never fixes, it's not time to see a chiropractor or massage therapist. It's time to see a urologist. Ignoring this gives those termites more time to weaken your foundation. And if you think back pain is the limit, the next sign hits directly at a man's ego, which is why it's often met with denial. 4. The silent connection in the bedroom. This is where male pride often speaks louder than health. Many men notice changes in sexual performance and immediately turn to the famous little blue pill, blaming stress or low testosterone. But the truth may be far more physical than psychological. The prostate isn't just there to mess with urination. It's a vital gland for reproductive function, producing fluid that protects sperm. When a tumor starts growing there, it can compress the erectile nerves that run right alongside the prostate, the electrical wires that send the signal for an erection. Beyond erectile difficulty, there's another warning sign you should never ignore: blood in the semen. It can be shocking, and for good reason. Seeing pink or reddish semen is a clear signal that something is damaging blood vessels or inflaming internal ducts. It's like a leak in a central engine component. If your performance has changed or ejaculation has become painful or uncomfortable, don't try to fix it with stimulants. The problem may not be the engine, but the wiring the cancer is trying to damage. Now pay close attention, because the final point is the most common mistake that kills thousands of men every year, and it happens inside the doctor's office. 5. The PSA mistake and real prevention. This is where survival separates from becoming a statistic. Many men firmly believe that if their blood test, the famous PSA, comes back normal, they're safe. That belief is dangerous. PSA is like a smoke alarm. It tells you something might be wrong, but not exactly what. An inflamed or enlarged prostate can raise PSA, while an aggressive tumor sometimes doesn't change blood levels at all. There are documented cases of prostate cancer with completely normal PSA. If you rely only on lab results, you're playing Russian roulette with your health. That's why the digital rectal exam is still the gold standard. While blood gives a chemical clue, the doctor can physically feel the prostate's texture. A hard, stone-like nodule can be detected immediately, even with a clean PSA. Prostate cancer has nearly a 100% cure rate when caught early, but it won't give you obvious symptoms until it's too late. Real prevention isn't waiting for symptoms, it's staying ahead of them. Don't ignore what your body is whispering today so you don't have to hear it screaming tomorrow. If you recognized any of these signs, or if you're over 45 or over 40 with a family history, your number one priority tomorrow morning is scheduling a visit with a urologist. Your family needs you whole, not just present.